To answer the question, that this is not a, address the issue that this is not a typical group of transplant patients, we were funded to do a randomized clinical trial in kidney transplant. And the purpose was to determine the effects of exercise training over the first year kidney transplant on health-related fitness, which is the VO2 max, the muscle strength and body composition, and the health-related quality of life. And this is what we did. We tested them 2 months post-transplant with a maximal exercise test, and then they were randomized into exercise training or usual care. Exercise training was prescribing exercise for doing at home, and then we would call them once a week, kind of personal trainer by phone thing. And then we retested them at 6 months and at 12 months. And we lost quite a few along the way for various reasons. But the testing was max treadmill test, muscle strength, body DEXA using for body fat, and then the intervention was cardiovascular exercise prescribed to do at home for 3 or more days per week for 30 minutes or more per session. They'd gradually work up to that. Here they are. Here's the demographics if you're interested in that. They were pretty typical people coming through the transplant center at UC San Francisco. This is our activity participation. At baseline, they were pretty similar. And at UCSF at that time, we had regular exercise, routine exercise prescribed for them when they went home. Everybody went through a rehab program in the hospital, and they were prescribed. So half of them, at least at baseline at 2 months, were still following that. It split off 6 months with the exercise trainers in the exercise intervention group, having higher physical activity, and then even greater at 12 months. So as time went on, people tended to drop off unless regularly encouraged by our study staff. Here's our VO2 peak. The first 6 months, both of them improved. And that's not surprising to me. We saw that after pre and post transplant. And then the difference came at from 6 to 12 months. So the importance of encouraging people long term and keeping them in and encouraging them for a long period of time for the rest of their transplant care is really important. Here's physical function score, that scale score on this SF36 quality of life questionnaire. It followed the same pattern as the VO2. And here's muscle strength, quadricep muscle strength improved. This is per body weight, and this is the absolute value. Same pattern. The exercise intervention was much higher, significantly higher at 12 months. So here we are again, transplant games, and here's our randomized controlled trial. So they do get up to sedentary normal values, the general transplant population, if you can incorporate that routinely after transplant and encourage them. So in summary of our exercise data, I've done now over probably 500 exercise tests in dialysis patients, and basically you have a max VO2 of around 20 mils per kg per minute, which is very low. If you exercise trained dialysis patients, you can get them up to 25 or 26. You can get a significant improvement. We don't normalize dialysis patients with exercise training. There's other things about dialysis and uremia that probably limit the levels they can achieve. Pre and post transplant, I kind of showed you this. We can kind of go from the 20 up to about 28 just with a successful transplant. And here's our transplant GAMS data where we have active people after transplant and inactive, significantly different. And what's interesting to me is these inactive transplant patients are not all that different, or actually a little lower than the active trained dialysis patients. And here's our randomized trial. And the same thing happened here. These usual care folks are pretty much the same as exercise trained dialysis patients. So in terms of liver transplant, we did a similar follow-up study with liver transplant. I guess this is a long-term part of our randomized trial, but this is, our randomized trial, I'll show you, started people 2 months after liver transplant. We wanted to find out what people were doing after 5 years after transplant. So we sent questionnaires out to 110. We got 110 out. We got a 47% return rate of that quality of life questionnaire at 5 years post liver transplant and over. And They were out to 10 years post-transplant, but 20% of them reported regular physical activity. And here's that scale, those scale scores. Again, those people who were physically active were significantly higher in all the physical scores, and actually in a couple of the mental health scores, than the inactive patients. These are long-term liver transplant recipients. They also reported fewer bone and joint problems, less blood pressure medications, and that obviously is a group of people who sent out their questionnaires and it's long term, but we also were able to do a randomized clinical trial look basically at what we did for the kidney transplant, and we added diet intervention. And so it was in liver transplant. I'm going to show you the exercise data. We started them at 2 months after transplant instead of 1 month, what we did the kidney transplant. Well, same thing, we randomized them into independent home exercise with a dietary consult regularly, and we tested them at 6 months and 12 months. And we had intervention where we ended up at 12 months, 74 people, in the usual care 80. In this group of the intervention people, we only have 37 people who really adhered regularly to the exercise intervention. And those were the people who followed the exercise prescription for frequency, intensity, and duration greater than 50% of the time. And half of them didn't. So that's always a problem with a randomized controlled trial. We did the same testing. This is what they look like. And we do split them out, adherers, non-adherers, usual care, because an intervention only helps if you participate in it. And so here's basically what we saw in terms of VO2 peak. Those people who exercised, again, had continuous increase in VO2 peak after liver transplant, but those people who were usual care didn't, and those people who didn't adhere to the intervention, obviously, look like the usual care group. So there's lots of reasons to prescribe exercise after transplant, but what's really interesting to me is in the United States, and I'm sure you do too, there are already recommendations for physical activity for various medical conditions. In hypertension, we have the JNC7 recommendations, and in this recommendation, the very first step, if somebody has high blood pressure, is to manage their weight and increase their physical activity. The very first one. Unfortunately, in the States, I'm sure that doesn't happen here, they tend to go just to the next step, which is medications. Hyperlipidemia, the National Cholesterol Education Project, the same thing. If somebody has hyperlipidemia, the first step is to manage weight and increase physical activity. Cardiovascular disease is a National Institute of Health consensus conference on regular physical activity in people who are at high risk for heart disease and those people who have known heart disease. And the American Diabetes Association, the triad is diet, insulin, and exercise. And in the States, we tend to just forget the exercise for some reason, and I don't know why, and I hope that doesn't happen here, but the fact that you're here probably indicates that